Week 5, Senior Project, Overview of Molina Healthcare Organization, Challenges in Recruitment and Retention for a Healthcare Administrator, and Suggested Training Program for Staff and Coordinators. Kathy E. Thompson, HCA 459, Senior Project, HCM 1742A, Instructor Karen Tompkins, November 20th, 2017. Molina Healthcare as a modern healthcare organization. Molina Healthcare was founded in 1980 by Dr. C. David Molina, an emergency room physician. Dr. Molina had a vision that he wanted to be able to provide low-income and underinsured individuals and families with affordable healthcare options, and instead of them relying solely on emergency room visits that were very costly and generally did not end in very good health outcomes. Molina Healthcare is currently a Fortune 500 multi-state healthcare organization, delivering healthcare services and offering health information management systems to nearly 5 million individuals and families. Molina Healthcare Organization structure and position of authority. Currently, the healthcare administrator position would fall under the authority of the Chief Operation Officer for Molina Healthcare, which is Terry Bayer. Recognizing the impact of recruitment and retention on stakeholders. Medicaid recipients in California, Florida, Illinois, Michigan, Ohio, Puerto Rico, New Mexico, New York, South Carolina, Texas, Utah, Washington, and Wisconsin. Recipients of Medicare Advantage plans in order to meet the needs of individuals with Medicare or who have both Medicaid and Medicare coverage. Molina Healthcare became a public trading company in July 2003 with a stock offering of $102 million. Molina recruitment and retention challenges. Molina currently has 29 clinics throughout various states. And because Molina has clinics in states that have a large Hispanic and immigrant population, it is necessary that recruitment efforts are geared and catered to individuals who are suitable to work with a diverse customer base. In August 2017, Molina announced it would close clinics in Michigan, Florida, and Utah. Recruitment and retention opportunities. Molina is a multi-state company and any recruitment efforts must be nationwide. Molina has been recognized as one of the best places to work in New Mexico. Molina is a formidable competitor in healthcare in the states that it operates in, and Molina has over 20 years of success in the healthcare industry. Molina Healthcare's competitors. It's important to note that Molina Healthcare's current competitors are multi-product managed care organizations, Medicaid HMOs, prepaid health plans, and primary care case management programs. Recruiting to keep pace with the future growth in healthcare. Based on this chart, the U.S. employment growth in healthcare and all other industries from the first quarter of 2003 to the first quarter of 2013 was 125%. Based on that type of growth, it is very important that recruitment efforts are active and ongoing with any healthcare administrator. Suggested methods to improve employment recruitment: seeking potential employees from online job sites, utilizing recruitment agencies, employee referral programs, hosting job fairs, always actively recruiting new talent, and promoting from within the organization. Suggested methods to improve employee retention. Employee organization value fit improves employee retention. Interaction between human resource manager, administrators, and employee organization value fit helps to improve employee retention. And this is what this current chart shows. That's provided by the International Journal of Human Resource Management. It shows that human resource practices, training and development, career opportunities, work-life balance, along with employee organization value fit equals strong employee retention. Why communication is key to improve employee retention. Creating job postings that attract the best recruits, making certain that managers provide complete job descriptions so that prospective employees can properly determine if they meet the job requirements, and conducting thorough interviews and follow-up interviews so that both sides get their questions answered. Creating great job postings. Everyone is out there posting, as you can see from the growth in healthcare. That also means that there are a lot of other healthcare competitors that are competing for the same quality employees. Therefore, job postings must be very accurate, complete, and timely and time managed so that responses are received timely. Managers also need to make certain that job descriptions are as complete as they can be so that no one is hired and money is not wasted on employees who are offered positions who are not qualified to fulfill them. Conducting thorough interviews, asking the right questions, making certain that the employees also can get their questions answered in their employment interview is very important. Therefore, the healthcare administrator must make certain that they are well versed in what managers are looking for out of their employees when they are conducting interviews. Methods for monitoring employee satisfaction, conducting periodic employment reviews, anonymous suggestions, submissions to human resources, assigning each new hire a partner or buddy to assist them in becoming oriented in their new work environment, making certain conflicts are resolved in a timely manner. Conducting periodic employment reviews is very beneficial for employees as well as management. This allows employees to gauge how well they're doing, how well they are fit in their current position, and if they are in need of any additional tools or training to do their job. Anonymous suggestions help human resources and management to identify problems that employees may not want to voice or bring up to management in a meeting or in an employee discussion. So anonymous suggestion box do help to pinpoint where problems might be occurring and how they can be resolved. Assigning each new hire a partner or buddy allows them to become oriented in what the company requirements are, what the company is looking for and expecting from them as an employee. And it also allows them to feel more at home in their job more quicker. And this, again, adds to employee retention. Making certain conflicts are resolved in a timely manner. You want to make certain as a healthcare administrator that any conflicts that are occurring are resolved in a timely fashion. Molina is delivering healthcare services and patient care is at the top of the list. Customer service cannot be avoided or deflected because there are other conflicts that are occurring within departments or units. So conflict resolution should be at the top of every healthcare administrator's list. The pros and cons of temporary staffing, the reason for choosing temporary contract work. As you can see from this chart, there's a lot of benefits to hiring temporary staff. It is a way to get a permanent job. Going from temp to perm should be something that should be always a consideration for management. Also, it is a way it was unable it's also for good for those who are unable to find a permanent job to be able to work in a temporary position while they still conduct a job search and to be able to keep their skills um, current. Also, to obtain work experience, this keeps someone from having gaps in their resume. So temporary assignments are very attractive to a lot of people who are still looking for that right fit for a permanent job. It also helps to improve skills. They may even peradventure learn new skills while they're in a temporary assignment that they can add to their resume. Flexible hours and schedule. Temp assignments generally sometimes allow for more flexibility in the work schedule, and that's attractive to a lot of employees between permanent jobs. And again, someone who is between permanent jobs may be very open to accepting a temporary assignment and going into a permanent one if it's offered. The modern trend of traveler nurses have already had their skills validated by their agencies. Traveler nurses are often seeking a permanent employment and are hoping a temporary assignment will result in a permanent offer. Travel nurses often have an organization on trial for consideration as a permanent employer as much as the organization has them on trial for a permanent employee. So this is kind of a win-win situation to have some of your employees be travelers, is particularly if they're nurses. This is a trend that is huge now in healthcare, and it's something that Molina needs to always have as a resource. The staffing coordinator position. It is the job of the healthcare administrator to supervise all staffing coordinators. Staffing coordinators are individuals that work at each of Molina's 29 clinics that are responsible for posting notices of employment opportunities within their specific clinic, reviewing applications, conducting initial interviews to make certain that an applicant's qualifications match the job requirements, participating in meetings with department heads in order to provide the healthcare administrator with any potential candidates. Suggested training for staffing coordinators. Staffing coordinators must be thoroughly knowledgeable in the specific staffing needs of each clinic. Staffing coordinator must be able to communicate effectively and in writing to make certain that all interoffice communications are sufficient. Staffing coordinators must have proper telephone etiquette and email etiquette, as they will often be communicating with potential employees and new hires. But every new hire needs to succeed. Ensuring new hires get off to a great start. Of course, there's the hiring manager at the top of this pyramid. There's the new hire in the middle. New hires need sufficient tools. They need support from team members and administrative professionals, such as the healthcare administrator. They also need the information they need to do their job well. And this generally sets someone up for success. That's a new hire. Finding and keeping the skilled and trained professionals. The healthcare administrator must make a commitment to hiring and training competent nurses. Nursing turnover can be extremely costly for an organization and therefore must be minimized. Orientation for nurse must be nurse-centered and quality patient care focused. It has been found that nurses who have a nurse-centered orientation do much better on their jobs, and they are also have a higher retention rate. Providing new hires with tools for success, offering employees flexible schedules, encouraging a culture of mutual respect, providing a challenging work that allows for employees to demonstrate their skill level, creating a work environment that cultivates learning and growth. Transitioning from a new hire to a permanent member of a team, implement methods of tracking employee performance. The healthcare administrator should have an open door policy for new hires to voice their complaints, concerns, and give suggestions. Offering competitive benefits or hiring incentives helps to retain the best and brightest employees. Employee rewards and recognition. Every employee wants to be recognized for what they do right and not just what they did wrong. And an employee recognition program generally will cost an employer less than experiencing employee turnover. Implementing inexpensive but effective ways of recognizing valuable contributions your employees make to the organization. Conclusion: hiring today to ensure Molina Healthcare's future success. Since Molina Healthcare's inception, it has appreciated phenomenal growth as well as some major pitfalls. However, Molina appreciates Fortune 500 status and a company stock that continues to make considerable gains. But if Molina is to remain as a formidable player in the healthcare industry, it must continue to see employee recruitment and retention as one of the major reasons for its current and future success. And references. Thank you.